Okay, very good. Excellent. Your testing today looks great.
Krista Stephens is no longer scared when the doctor uses a needle to inject medication into her eye. What scares her is she's going to go blind. That's unless the government eliminates a cap on eye injections needed to treat her macular edema, which developed as a result of her diabetes.
Like the thought of not being able to see is scary. You know, I feel like I'm young and I'm not ready to go blind.
Under the province's drug program, she's only allowed 9 vials in her lifetime, and she's already used way more than that.
It's so frustrating knowing that the medication is there, it 100% works, it's fantastic. But I can't have it because government says, no, we're not going to cover that here.
The brand name drug she needs costs about $1,800 a shot. The generic brand, although much cheaper, didn't work for her. Her ophthalmologist has enrolled her in a compassion program where the drug company pays. He says he has more than 100 patients who rely on that program because they've all exceeded the cap, and the program could end at any time.
I had a patient once that said I had the choice of eating or having my medication. And you know, it's a bit heartbreaking, you know, because as a physician, you want to be able to help all the patients that come through the door. But unfortunately, this is handcuffing us and preventing us from being able to treat the patients as they should be treated.
The physician says Newfoundland and Labrador is the only province that has a cap on intravitreal injections. The Minister of Health and Community Services was not available for an interview. However, in a statement sent to CBC News, the department says they follow an evidence-based review completed by the Canadian Expert Drug Advisory Committee, and further said it's our responsibility to ensure that we spend our public funds where scientific evidence supports significant health outcomes. But both the Canadian Retina Society and the Canadian Ophthalmological Society disagree with that review. In a letter that was sent to the minister, the societies say that the current coverage falls short of what is needed to maintain vision and that the current policy is putting people at risk. People like Krista Stephens.
People are going to continue to go blind if they don't change something, and it's like nobody cares.
Meg Roberts, CBC News, St. John's.